Okay, so we're talking about what are the healthiest families in the world doing. And I'm Dr. BrieAnn Reedy. I don't know, I haven't probably met all of you, but I'm the newest addition to the staff here at Hassel Family Chiropractic. So you probably saw me, some of you maybe, when I was in with Dr. Hassel. But anyway, so we're going to be talking about what the healthiest families in the world are doing. And it's no surprise they're obviously under chiropractic care, right? So if you've been to dinner with the docs before, which I know there's quite a few familiar faces here, you might remember a slide similar to this that we've talked about in the past, that when the sperm and the egg meet and then they start to duplicate, and it's the only time when two cells come together to form one cell, and the nervous system is the first thing that is made. So that's why our job is so important here. But this is going to kind of be the focus of my presentation tonight, back where it all started. So we're going to be talking about pregnancy, and I realize a lot of you can't even humanly get, some of you can't even get pregnant, but and some of you aren't planning on getting pregnant, but I bet most of you know someone who is planning on getting pregnant, or in that childbearing age where they could get pregnant. So hopefully you find some useful information. There you go. Yeah, so maybe you'll learn something that you can share with them. So we're just going to focus on taking care of your body during pregnancy, or your friend's body during pregnancy. So the equation to health, which we've talked about here, Dr. Hassel focused on, I think Dad talked about it a little bit. We need to function well, eat well, move well, and think well. Then if we do all those things right, we should be healthy. Okay, so most of you know that you should get your nervous system checked on a regular basis because your patient's here, but some people in this room actually have never been in our office. So we're going to hit a little bit about on what a subluxation is, and so some of you can just kind of tune out because you're so smart and you already know about subluxation. But so the brain sits up here, and messages run from the brain down the spinal cord and out these nerves to every cell, tissue, and organ in the body. And when the spine is aligned like it should be and all the motion is good, then it's fine. The signals coming out are 100%. But what happens is we do things in our life, stresses. We have mechanical stress, chemical stress, and even just stress in general can cause these bones to move out of place and then put pressure on that nerve. When there's pressure on that nerve, there's going to be less than 100% function. So that signal can't get from the brain down the spinal cord into whatever cell, tissue, or organ in the body it's supposed to be innervating. So if that signal is supposed to go to the uterus and tell it to contract when you're delivering a baby, and that signal is being blocked, it's going to be tough to deliver that baby. So a lot of times, you hear people having interventions and stuff, and it'd be interesting to know if they'd gotten checked before they went into labor. So, and also like the hormones throughout pregnancy are controlled by the nervous system too. It tells the body when to release those hormones and things like that. So if the hormones that are supposed to be there to maintain the pregnancy aren't released, you've heard of people having miscarriages, things like that. I didn't find any studies on the correlation between the subluxation and that, but that would be interesting to know too. So obviously it's going to be important to get your nervous system checked all the time, but especially during pregnancy. So why else would it be important? Just not because of just obviously the nervous system is huge, but also there's mechanical changes that take place in the body. So the typical woman gains 20 to 40 pounds during pregnancy, and all that weight is in the front half. So their center of gravity shifts a ton. So their abdomen gains most of the weight, and their breasts enlarge, all that. So all that's out here in front. So your posture has to change to accommodate to that, and just the overall center of gravity. You can see on this diagram a little bit. It shows where the center of gravity is, and number one is like just a normal person. Then as they get pregnant, how that center of gravity shifts, and you can even see that stress it's having there on the lumbar spine, how it's because the curve in the lumbar spine increases, so that causes more stress on those joints. And those nerves that come out of that lower back there are also the nerves that go to the uterus, and they supply the reproductive organs. So it's really very important to get checked when you're pregnant, especially towards the end of pregnancy. And we talked about hormonal changes a little bit, but for those of you who don't know, estrogen and progesterone are the chief pregnancy hormones. Progesterone causes laxity of the ligaments and joints in the body, and it also causes the uterus to enlarge. And estrogen helps maintain the pregnancy and causes maturation of the baby. So obviously we want our babies to mature when they're inside of us, and so it's important that we have the right level of estrogen being produced, and like I talked about, maintenance of the pregnancy, progesterone, you want to have the right amount of that being produced too. And then finally, relaxing is released more so towards the end of the pregnancy, the last few weeks of pregnancy, and this just lets all the ligaments around the pelvis relax, and that helps in the birth process. So if those ligaments are tight in there and stuff, and the relaxing's not going to them, then it's going to be harder for the pelvis to open up like it should to help to push that baby out. And relaxin also can help to cause some of those subluxations too, because the pelvis and all that starts to move a little more than it used to, so things start to change, and so very, very important to get your spine checked when you're pregnant. This is, I think, pretty cool that somebody in the field, another doctor at another office, took an x-ray of a spine like this, just down the birth canal like that, to show what a normal birth canal is, and then AS and PI misalignment, so the one on the right, that's just a way that the pelvis misaligns. So these big bones on the outside are called ilium, as some of you might not have been new patients recently, but you heard this all once anyway. So what the body does is so if this misaligns a little bit, so it's gone anterior and superior, that's what AS stands for, and then the other one does the opposite, so it goes posterior and inferior, because the pelvis works like it's all connected together, and so if one ilium does this, then the other one has to do the opposite. So that's how we walk, and that's how we do all of that. But you can see there's tremendous amount of difference in the birth canal, just how big it is and everything, if you have a subluxated pelvis. So very, very important. I actually have a picture of this on my phone, so I can just show people whenever I see someone pregnant, I'm like, oh, you need to be getting adjusted. Look at this, seriously. But I mean, personally, I don't really know how or why a baby's supposed to be coming through this little tiny hole, but you should really get checked, because you don't want to be any smaller than it's supposed to be. So. And this is just another picture of a different type of misalignment, because there's two different planes that these move in, so it can move this way or it can move internally and externally. So, and I was talking to Dr. Ross about this earlier today, and he was telling me that since he just recently had a new little baby, he knows a little more about the whole birth process than I do. But so how the pelvis works is once the baby drops down in here, it's almost like a clothespin, how the baby drops down in there, and then the pelvis and everything is just, if it's aligned correctly, is supposed to shift and kind of squeeze that baby out. So when it drops down in there, it's like this, and then it's kind of like that. And so if you don't have proper alignment, you're going to have to, a lot of times, they have things that some interventions that maybe aren't really what you were looking for when you went in to have your baby or part of your birth plan. Because a lot of times, they'll start doing things that like relax or put pitocin and stuff like that, and a lot of times people were going into having the birth that wasn't on their list of things they wanted to have done. So very important. So some common symptoms. Most of you know we treat the cause here in our office. We don't treat the symptoms, but we've got low back pain, acid reflux, constipation, morning sickness, headaches, mood swings, cravings, frequent urination, tender breasts. A lot of those are affected by the nervous system, obviously. So if you come in and get adjusted, we can fix that and you have less symptoms. I know a lot of people, the only relief they can get from their low back pain, acid reflux, stuff like that, is from a chiropractic adjustment when they're pregnant. So, and a lot of you have been adjusted here, and you know the knee chest table, the one where you have to put, where you kind of kneel down. A lot of pregnant women like that one because they get to let their stomach just hang down, and I've heard some people say, I wish I could just like take one of these home. So, yep. And next we're going to talk about moving well. So moving well is just exercise, obviously. And exercise used to actually be contraindicated during pregnancy. Like doctors would tell people to not exercise, but they rethought their process and everything, and it is recommended to exercise during pregnancy. And this woman actually, this is a pretty funny story, I think, but she might have taken it just a little bit too far.
As Erica just mentioned, she was 39 weeks pregnant, but still with a doctor's okay. She ran the Chicago Marathon this past weekend, and then the baby said, I'm coming out. Sister Dennis has the story.
The Chicago Marathon, 45,000 runners from all 50 states and more than 100 countries, and somewhere in that sweating sea of humanity, 27-year-old, 9 months pregnant Amber Miller. Amber ran 26.2 miles on Sunday in an amazing 6 hours and 25 minutes, beating husband Joe by 19 minutes. And then, just a few hours later,
I started labor soon after, I thought it was labor soon after the race was over, around 3 o'clock. I was having a conversation with my parents the night before, Saturday night, and I was telling them, you know what, I honestly have no plans of actually finishing, because obviously I have run a marathon pregnant for the 38 weeks.
That's right, she was only 4 months along when she ran a marathon during her first pregnancy. On Sunday, Joe Miller was supported but nervous.
What are you going to do? We go into labor downtown and ran the marathon with 40,000 people.
I was feeling good. I started out with running 2, walk 2, run 2, walk 2. Problems was really good. Maybe we could have been eating.
Oh, and after finishing that marathon during her first pregnancy, Amber wasn't done.
She makes it
While she was pregnant with him.
while she was pregnant.
Mom and baby girl are both doing fine this morning. If both are just a little tired.
Yesterday was pretty stressful for her too.
Susan McGinnis, CBS News, Washington.
I thought that was pretty crazy. So, yes, obviously.
Would you do that?
I might, I don't know. I haven't run the Chicago Marathon, but not pregnant, obviously. So, but yeah, so exercise is recommended, and you know, if someone like that had been running through their pregnancy, you know, it's going to be a little bit different than someone who just, yep, I'm signed up for the Chicago Marathon, I'm 9 months pregnant, I'm still going to run it. You know, if they hadn't trained and things like that, obviously that changes. The OB and Gynecology Association of America actually recommends that you exercise 3 to 4 times a week when you're pregnant, and I really think that that's going to vary. If you're someone who works out 6-7 days a week, I don't think you should change what you're doing. Obviously, change the intensity as you go along and you start to get larger and you know things start to change a lot. It's important to customize the workouts like I have here, and they recommended aerobics, swimming, resistance, exercises, impact, and non-impact activities. So I think that pretty much covers about anything you could do. You can probably do it. It did say that you shouldn't do things like play softball or something like that, where you know you might get a ball into your abdomen where the baby is. So. But it's important, even, I know, like, I'm a runner, so I follow running a lot, and a lot of the athletes that run, like, marathons and even in the Olympics and stuff like that, you don't peak until you're about in your 30s, so a lot of them get pregnant sometimes, and they run through their pregnancy, but they customize the workouts, so towards the end, obviously, they're not doing the same, like, 18-mile runs they were doing when they were 8 months pregnant, so. It's just important to customize and obviously always exercise, because it's important to do that before you're pregnant too. So the benefits of exercise: easier labor and faster recovery from birth, and I think all the moms in here can say easier labor would be awesome, and the dads could probably say that too. A lower risk of gestational diabetes, fewer pregnancy symptoms like we talked about before, a leaner baby, lower risk risk of premature birth, improved mood for the mother, obviously, and the dads are probably all saying that would be a good thing too, and a lower heart rate and increased variability for the baby. So that just means increased variability just means that the heart is stronger. So because you're working out, the baby's getting stronger too. And in one thing I read, it was like, it's almost like you're prepping yourself for birth by doing all this exercise before. So. Okay, now moving on to eating well. Obviously, a lot of these things are going to be similar to what we should be eating now when we're not pregnant. You know, we should choose fresh, organic foods whenever possible. Eat a well-balanced diet consisting of adequate protein, healthy fats, fruits, and vegetables. So adequate protein, what does that mean? It means lean meats, meats that are grass-fed rather than grain-fed, hormone-free, and especially also when you're talking about protein, you want to avoid seafood a lot of times, they say, during pregnancy because of the mercury levels that can be in the seafood, and it's toxic to the developing fetus. And also, it's important to avoid deli meats during pregnancy because of listeria, which is a bacteria that can develop in the cold meats, in the deli meats, and basically it can cross the placenta and it can cause a miscarriage. So I know that my niece was just born, but my sister-in-law was like saying that she wasn't eating deli meats, and Mom was like, I never heard of that when I was pregnant. So just some interesting things they're finding out here as things develop. And eating green leafy vegetables is a must because there's an increase in folic acid. So a lot of times people supplement with folate when they're pregnant, and it decreases the chance of neural tube defects. So neural tube defect would be like spina bifida or cleft palate, anything with the nervous system. So if you're making sure you get those green vegetables is very important. Avoiding caffeine, I thought this was crazy. There was a study done that as little as 2 cups of coffee during the whole pregnancy, not just in one day, during the whole pregnancy can have an effect on the fetal heart development. So that's really, I thought that was something crazy because I know a lot of people are like, well, I just only have 1 coffee a day now that I'm pregnant or something like that. And also caffeine is not just in coffee, you know, it's in soft drinks, it's in chocolate even too. So just important to monitor that and avoid it if at all possible. And then drink plenty of water, which obviously everyone should be drinking at half your body weight in ounces of water. So as you're getting more and more pregnant, you're going to be gaining more weight, so this should go up. So as you gain more weight, you should drink more water. So also very important. So why is it so important that we eat well while we're pregnant? Well, epigenetics is the study of, it's a new thing kind of, but it's just basically that the environment can affect your genes. It can't affect your DNA, but it can affect how your genes are expressed. So if you're raised on, you know, a poor diet, then you're going to have a different expression of genes, whereas if you were raised with a healthier diet. So that goes for the same as the fetus is developing. And you can actually, it showed that in this research that I found, it said that it could change the expression of the genes. So if your child is predisposed to something, you can actually avoid the predisposition to it if you're eating really healthy and clean while you're pregnant. And obviously the poor nutrition, the same thing. So if all you're eating is McDonald's and French fries and stuff like that while you're pregnant, those chances of those predisposed conditions is going to go up. So that epigenetics is pretty cool stuff, and I think anyway. And then influences the foods your children will like. I don't know if anyone's ever heard of this, but like mothers who eat like a lot of fruit or something while they're pregnant, their kids, when they start to decide what they like to eat, a lot of times they start to like fruit a lot too, and it's just kind of crazy little thing, but I mean, that thing's developing inside of you, so it's going to have some of the same likes and dislikes that you had while you were pregnant. So. Okay, so key supplements that are important to take, obviously prenatal vitamins, you should always, that's something that everybody knows about, so I was going to hit on some things that people might not know as much about. Omega-3s, and a lot lot of people are deficient in omega-3 and they don't know it, so because omega-3s come most commonly in fish oil, so especially during pregnancy it's important to supplement that because you're not supposed to eat fish. So, and it's essential to the development of the child's nervous system and their immune system. So obviously those are two huge things, you know. Your nervous system controls everything, and your immune system, you know, nobody wants to have that kid who's always sick, so. And it can cause a lifetime of unexplained emotional, learning, and immune system disorders if you're deficient in omega-3. So all this new research is just, it's pretty interesting. And then vitamin D, and it's essential to brain development, and a lot of people are deficient in vitamin D, especially around this area because of where we're located based on the equator and all that stuff, so we don't get as much sunshine as people who live in California and stuff like that. So it's essential to go outside when you're pregnant, and the best way to get it is through your skin, but you can also supplement with it. And there was a study that showed there's lower levels of autism associated with sufficient amounts of vitamin D. So if it's that simple as taking a vitamin D, I think parents would say, yeah, that's pretty easy to do. So, and now probiotic. So you obviously all know that you have bacteria in your gut, and they're good. They're all supposed to be there, and we want to make sure that we have those bacteria. And so probiotics, that's what they do. So when you're supplementing for a probiotic, you're making sure you're maintaining those bacteria in your gut, and they can increase your immune function, and it can decrease the chance of allergies and eczema in your fetus, so as they're developing. Yeah.
Now, are you able, obviously, to do this afterwards? I mean, will this help the conditions of autistic children if they do take vitamin D?
Yeah,
or,
you know, I'm not sure
eczema,
about that.
You know,
Yeah.
probiotic, obviously out of the fetus.
Right, out of the womb.
Yeah.
I
Out of, yeah.
like born a baby, yes.
Right.
I did not look into research about that, but I would not be surprised, especially, I mean, I don't know if you could like change the autism or maybe just decrease like how like severe it is, because there's like a scale, I think, with autism. So I'm not sure about that though. It'd be interesting to find that out. Yeah. And yeah, if any of you have questions at any time, let me know. Okay. So now finally on to thinking well, and you've probably heard Dr. Vince say this, no stinking thinking. So you want to always have a positive attitude, and that's gonna, I know it sounds silly maybe to some of us, but it's gonna affect everything, even the developing fetus. And if you're depressed, they found that mothers who were depressed while they were pregnant, their babies when they were born were more irritable, had more erratic sleep patterns, and even developed behavioral disorders when they were older, like when they went to school. And there's a correlation between mothers being depressed and that, so I thought that was interesting. And then you should eliminate as much stress as possible. So mothers who experience stressful life events are at greater risk of delivering prematurely. And I can attest to this because when I was little, my mom was pregnant with my little brother, and we moved, and I think within a week of us moving, which I was 2 and I had 2 older brothers, so there were 3 of us, and my mom had to get everything packed up and, you know, get us all moved and everything. And after we moved, she went into, her water broke in January, and my brother wasn't due till March. So definitely stressful events can have an influence on that. So, and it can also increase psychological disorders in children. So that's further down the road, obviously, but schizophrenia and things like that, or even depression. So just try to avoid those stressful life events if you're pregnant. And then a positive attitude, like I talked about before, just enjoying your pregnancy. You know, a lot of people just focus on the negative things. Well, I have morning sickness, and I have this and this and this, but it's going to be a lot better if you just turn everything around and say, well, I have morning sickness, but it's a good thing because my body's trying to get rid of something, so this fetus is developing correctly, you know. Just think about it in a different way. And also, we haven't really talked about fertility at all, but a positive attitude can have amazing results with fertility too. So instead of always thinking, oh, I'll never get pregnant, you know, those people who have trouble getting pregnant, if they just start thinking more positively, it can also have an effect on that. And then I threw in this slide about sleep because I thought it kind of fits in with thinking well, because we all need to sleep. The body repairs while it's sleeping, so obviously sleep is very important, especially while you're pregnant, because you know, you have a baby developing in there. You need to make sure you're getting enough rest so that your body can function at 100%. And immune function is affected by sleep. And a lot of you probably know that, you know, when you stay up too late, you notice the next day, you know, it's a little harder, and sometimes even you notice your throat's a little bit sore and things like that. So, and how much is enough sleep? Well, in one of the studies I found, it said that you should get at least 6 hours of sleep every night. And this doesn't change when you're pregnant, but they did say that when you're pregnant, obviously it's important to make sure you're fully rested. So if you wake up, a good rule of thumb, if you wake up and you're still tired, you're not getting enough sleep. So you should try to get more sleep the next night. So, and getting to bed early, this also, I didn't know before doing all this research, that the adrenal glands, which handle stress, if you were here last week, Dr. Thad talked about, you know, the adrenal glands and how they secrete cortisol and the stress hormones. They actually, that's when they recover and repair, is between 11 p.m. and 1 a.m. So if you're not sleeping, then your body doesn't know it should be recovering and repairing. So that's why everybody should be asleep by 11 p.m. And the best position to sleep in is on your back typically, so for the normal population, but actually when you're pregnant, it's ill-advised to sleep on your back because of the reduced circulation, and so they recommend sleeping on your side, and the left side is the best. And you're not supposed to sleep on your stomach ever, so it's bad on your spine, so because you turn your head one way or the other, so it's hard on your neck, and it also is hard on the low back. So.
Now, you said the general population is flat on your back,
Yep.
or with your legs straight, or
Yep. And actually, it said too
upward?
that if you're gonna sleep on your back, you actually don't even need a pillow, because then your neck isn't gonna be propped up. So, but if you sleep on your side, you can also put a pillow between your legs, and that leaves your spine mostly in a neutral position too. So, yep. And sleeping obviously can contribute to your mood, which we were just talking about, no stinking thinking. So a lot of people, you know, that person who didn't get enough sleep, I know when I was younger and we'd have slumber parties and I would stay up all night, my mom would be like, I don't want you to stay up all night because you have to come home to me the next day, and then I'd just be cranky. So. Alright, so keeping pregnancy natural. Pregnancy is a natural process that the body goes through. A lot of times in the medical community, they almost treat it as like a foreign body or something, but it's something that's supposed to happen. So keeping it natural is what we're all about here at our office. So if we can help you keep your pregnancy as natural as possible, that's what we want to do. And this is my new niece who was born on the 2nd. Her name is Jalen. So I had to throw a picture in there to show her off a little bit. And, okay, so you're not pregnant, that's okay. You learned something tonight, I'm sure, so you can tell that to someone you know who's getting pregnant or at childbearing age. And if you're interested in learning more about natural childbirth or even home births, you can talk to Dr. Thad, and he just actually had a home birth about 6 months ago. His little girl was born at home. So, and then Dr. Ross, I know they had a midwife, so I think they had it in the hospital, but they used a midwife. So just some, if you want to talk more about that kind of stuff, they'd probably be the experts on that. They probably know connections here in the Moines area for that kind of thing. And so also everyone here and anyone you refer to me within a week can receive first day services on me, so they don't even have to be pregnant, but if they are, that's awesome. So yeah, that is all I have to say, but if anyone has any questions about anything else or any discussion.
I'll ask a question. I have,
Okay.
I think I just told you recently, I have scoliosis.
Mm-hmm.
And I'm always curious about how that's gonna affect my pregnancy when I do get pregnant. If
Yeah.
I'm gonna be in a lot of pain, or if it's actually gonna take some pressure off of my spine.
Yeah, it'll be interesting. It'd be interesting to see like an X-ray of your spine before I can really tell you for
Mhm.
sure. But it depends on where the curves are and how severe they are.
Mhm.
But yeah, there's probably definitely gonna be some influence on those nerves coming out of there, especially if it's never been corrected or looked at. So, yeah. Anyone else have any questions?
I would say my daughter, with her second pregnancy, was coming here with Dr. Ross, and both of her pregnancies were fairly easy, but I think her second one was even easier, and mine were awful. And I didn't go to a chiropractor regularly during that time, so I would say that, you know,
Yeah.
I wish I would have known then
What
what
you
I know
know
now,
Yeah.
you know,
Yeah.
because my first one was awful. Right?
He's a good boy.
He's a good boy. The delivery was awful.
Oh.
Yeah. Well, and I mean, outside of the delivery too, a lot of women complain about low back pain, but while you're pregnant, you know, it's not like you're not supposed to be taking any drugs or anything like that, so, you know, a lot of people, that's what they turn to in their everyday life when they have low back pain, so definitely chiropractic is a huge deal there too, and like even physical therapy, some of the modalities they use are contraindicated when you're pregnant because they could, if they're in the low back, they can go into the fetus, so a lot of those like electrical stimulation and ultrasound and things like that are contraindicated during pregnancy, so chiropractic should be number one on people's list when they're pregnant and they have low back pain, so.
No, but that should be number one on the list.
Well, yes,
Anytime, right?
it should be anytime, and especially because of the nervous system and the functioning that's, I mean, everybody wants to have a healthy baby. Nobody wants their baby to come out with 9 fingers and 9 toes, you know, they all want 10 fingers and 10 toes, so. Important to have that nervous system functioning at 100%, so.
I was interested, or, you know, when you mentioned about the caffeine intake and how little, because I do hear a lot of pregnant women that say, well, in moderation, whether it's alcohol, caffeine,
Yeah.
chocolate, and I suppose everybody's got their own take on it, but I mean, to think 2 cups throughout your whole pregnancy doesn't
Yeah.
seem like a lot, but
Right. It's crazy to think about, and yeah, I know people who have, but if you've ever heard Dr. Mills say, they'll be like, if we just like, oh, if we just dump like 1 tank of oil into the ocean a day, is that okay? It's just our one thing that we do. No, that's not okay. So, yeah. All right. Any other questions? Good. Awesome. Well, thanks for coming.